And basically what the alarm is doing is actually telling the brain that the bladder is not under control. Once the brain is aware of the problem, it is the brain which will establish the link between the brain and bladder become established, and then it is the brain which controls the bladder, and the child becomes dry. So what the alarm is doing is actually speeding up the natural process and compressing these unknown lengths of years. If you have a child who is 5, you don't know whether they're going to be lucky enough to be cured next year or the year after, or sort of by the age of 13. So what the alarm is doing is compressing this unknown length of time into a maximum of 3 months. We know of children who are dry even much quicker, but we talk about 3 months maximum for a child to be naturally, to become dry when they're using the alarm. And the way the alarm works, in a way, is similar. If you have to wake up at an early hour every day to go to work, say 3 o'clock in the morning, and you set your alarm clock, after a few days you find yourself waking up just a minute before the alarm clock goes. I'm not quite sure scientifically we can explain what the body is doing, what the brain is doing to program itself to wake up just precisely so close to the desired time. But the brain knows it's important for you to wake up, so it does the necessary programming to wake up at that time. When you think about the alarm, it's actually doing exactly the same thing, but in the opposite direction. The brain knows you are not supposed to wet the bed when you are asleep. So once the brain is aware of the problem, when the alarm sounds, as the urine and the sensation of passing urine is, the brain is aware of that sensation, then the brain does the necessary changes, so you become dry. So the alarm is basically making the brain aware of the problem, and it's the brain which will make you dry. And when you are using the alarm, you don't end up waking up just before you wet, or getting up frequently during the night to empty the bladder. You do not get up at all, and you don't wet. So you achieve dryness in the same sense as most of us achieve it. So it is actually a permanent cure. It's not something temporary measure to prevent wetting the bed. It's actually curing the bed. While with drugs, it's very often is trying to reduce the quantity of urine you release or the frequency of wetting, if they work at all. And most children don't even work. So that's a subtle difference between alarms. Alarms cure. Drugs, if they work at all, they are managing the problem but not curing it at a very high expense. As I said, the alarm is a battery-operated buzzer with a sensor. The best place to attach the alarm is somewhere near the shoulder on the pajama top or night dress top. Hence we use the safety pin, a nappy pin, to attach it, because there's no sort of sensible way of attaching it somewhere near the shoulder. The advantages of having the alarm near the shoulder is that it is comfortable when you are turning in bed. It's not digging into you. The sound is near the ear, so you are not being muffled by the duvet or blanket. And if the child did flood the bed, it's less likely for the alarm to get flooded. So it is a very good place to put it. You thread the sensor through the pajama top or the night dress, and you attach it to the outside of the underpants in the appropriate place where you feel it's going to get wet first, depending whether it's a boy or a girl. You fold the material, put it in the jaw, lower the lever, and that attaches the sensor to the underpants. And when the child starts to wet, the alarm will go off, and the child has to remove the sensor from the underpants and then press the reset button. This is intentional, so the child does wake up and remember the event. So the brain is aware of what's happened. We do have another sensor which can be used with inside a sanitary towel or sandwiched between two pairs of underpants also. And for people who still prefer to use bed mats. We do have a slimline bed mat which can be attached to any of the alarms, but obviously then you don't wear the alarm, you place it beside the bed or attach it to the mattress. The different colors are different sounds, as I said earlier. So, I mean, we are trying basically to be as helpful as possible so the child will choose the sound they like or the color they like. The 8th sound, the yellow alarm, basically is for any child who claim they are getting used to the sound. So every time it's triggered, it's a new sound. And we have a vibrating only alarm that's purely for children with hearing problems or deaf, and tuned to waking up to vibration only. We have this range, the ultimate range. This has sound and vibration. And the advantage of using sound and vibration, apart from the fact you are getting 2 stimuli to start off with, is the ability to use it on vibration only. So as long as the child does wake up to vibration only, then if they are sharing the bedroom or if they need to use the alarm away from home, they can actually discreetly use it by putting it onto vibration only. And again, we have 3 single but different sounds, and the gold one is 8 sounds, and we have these 3 selectable ones where you could, apart from the sound and vibration and the random 8 sounds, you could select individual sounds if you wish. Then for children with special needs, autistic children, we have this range, the MO5 range, where you can, apart from having the sounds and vibration, you have the ability to record a message, music, a phrase which mum uses, so this child is aware of what's going on, and can be used obviously also if a child has got a mobile phone, you could record the tone of their mobile phone, and the chances are they will wake up to that to their mobile phone sound. So, but with whichever alarm you're using, it is vital for mum to help the child wake up when she hears the alarm for the first few nights until the child wake up themselves. So it is important to emphasize that. It's also important to emphasize that it's not, using the alarm is not an overnight success. It takes maximum of 3 months, but most children are dry long before then, before 3 months. But maximum within 3 months, we do expect the child to be completely dry, and that means over 14 dry nights consecutively.